This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. By Crime Stoppers of Southwest Florida. Report crimes and get paid with nobody knowing your identity. 1-800-700-TIPS. And by Lee Health. Welcome back, Southwest Florida. We're so happy that you joined us here this Sunday morning. Where are we? We're nestled on the Caloosahatchee River at the historic Burroughs home. And of course, Lee Pitts Live. We're all over Southwest Florida. This has been one of our finest accommodations. Big shout out to the folk at the at Uncommon Friends in the Burroughs home. What you see behind us is the Caloosahatchee River and the Edison Bridge headed southbound coming from North Fort Myers in the Cape Coral area. So we'll be here for a couple of more weeks. We have a new show a new segment that we're going to be unveiling in our lineup throughout Lee Pitts Live 2019. So we're excited about that as well. Today we get a chance to hear from Tashika Perry. Girl Talks Finance will be on the show. We'll also get to talk to Chris Grisby, the correspondent for Truth Media. You've heard his name before over at Wink News. Now he's moved on to what I call bigger and better things. And we're going to unveil our new show today, segment, Arise to Your Health with Yajaida Vasquez. So we're excited for her as well with Suncoast Medical Center of Southwest Florida. And speaking of Yajaida, we have her here. Welcome, Yajaida.
Well, okay, thank you for having me.
It's good to get you here. People saw you on the show a few months ago and just were thrilled. And when I watched you on the show, I said, oh, now that's a star. She's made for television. You don't know that. I just said, hey, I got to talk to her about having a segment on the show. So great job in terms of delivering great information about keeping people healthy.
Thank you. Yeah, we're excited to start this new segment for 2019. We're trying to keep people healthy and well informed. And this is all about empowering, our folks at home.
You have a down-to-earth approach to talking to people. That's what I like about you. Even though you got the fancy title of, advanced nurse, registered nurse practitioner.
You got it.
But you're able to break it down and talk to people in a regular way. Where did that come from?
I just felt that I relate to them by being a patient myself. No one likes to go to anywhere stoic. They like to just meet with someone and have just a nice conversation about what they feel when they're the most sickest and the most vulnerable. So I just relate to being just a regular person with everyone else.
Prevention is best, though, right?
That's right.
Eating properly, doing the right things with your body that can ward off a lot of different sicknesses.
That's right. And that's what we're going to be talking about in that first segment. So I'm excited that you brought that up.
Okay, well, we're looking forward to your first segment and segments in the future. I understand that you're going, from time to time, you bring in various people and interview them as well.
Yes, there's great providers here in our area and in our community. And there's a lot of information that people need to know about. And so we'll bring their expertise on and share it with everyone.
And your information for Suncoast Medical Centers of Southwest Florida will be on the screen throughout the process. People can always contact you. You're not just a pretty face on TV, but you actually have a place that they can come and get medical care.
That's right. It's Suncoast Medical Centers of Southwest Florida.
Okay.
And so, yeah, we are there in Lehigh Acres, ready to see our patients whenever they are.
Okay, when we come back, Yajaida.
Hello, everyone, and welcome to this new segment here at Lee Pitts Live. My name is Yajaida Vasquez, nurse practitioner, and I'm coming to you sponsored by Suncoast Medical Southwest Florida. And the new segment is called Arise to Your Health with Yajaida Vasquez. So I'm really excited to be here, like I mentioned, because it's giving me the opportunity to step out of the office and just come and talk to you, have some nice and candid conversations about your health, subjects that are important to everyone in our community. And in the future, we're looking to bring in some other guests that can help answer some questions as well. We have a lot of good medical providers and other partners to your health that are going to be instrumental in helping us getting you all of that great information. So today, we're going to be sharing some things about our topic. We talked about this earlier when he introduced me, which is about prevention and how important this is. I do want to mention one thing, and is that the information that we give out here does not replace the information that is given to you by your medical provider. So keep that in mind, because we don't want to give you anything that jeopardizes that. So the relationship that you have with your medical provider is really important. And so that's what this topic is going to be all about. It's going to be about meeting your medical provider, establishing your care, and how important it is to get some prevention as part of your day-to-day when it comes to your medical care. So let's talk a little bit about that. I'm sure that you've all heard how an ounce of prevention is worth a pound of cure, right? So that's really important when it comes to, even though that saying was something about fires, really, it was about fire prevention, we use it a lot when it comes to your health. And it means that we need to take care of ourselves because we want to take care of things before they become a big problem. It's something that, we can't take care of after it becomes catastrophic. So it's important that we do that so we don't have to fix a lot of things. And when it comes to prevention, it gives us, and I'm going to talk about first as a provider what that means to me. Instead of someone coming to me with a whole bunch of ailments and diseases and to talk about how bad they feel that day, it gives me an opportunity to meet each other, to talk, ask questions, and for me to really get to know you a little bit at a different level so that I can better take care of you. So that's what's important there to me. So let's talk about that prevention screening and what that means, because different people call it different things. So it gets a little bit confusing. So some people call it a yearly physical or an annual exam, or some call it their yearly annual exam too, or wellness exam, like a screening. So I call it a prevention screening because for me, that means that we're, again, preventing disease in the future from coming. But typically what it is just that, again, that opportunity to meet and talk to your provider about yourself. And I'll tell you a little bit about what to expect when you go to meet your medical provider at that time. So you have to be healthy when you have that appointment. And at that time, your provider is going to go over some things like your general health throughout the year, your weight, what medicines you're taking, your family history, any changes that have occurred throughout that year, and then go over some very valuable tests that you may have to have, like blood work, colonoscopies, prostate exams, pap smears, things like that are important, that are pertinent to your particular age range. And then they will do a complete exam where we can find abnormalities that are there and discuss them with you. It's kind of like you're going to a game and you're going to meet your coach, and then you're coming up with a game plan. So this is what we're doing, we're just coming together as a team and talking about what we're gonna do and how we're going to achieve the goals for the next year. So it's kind of like a vision thing for yourself and for your own health. So when we get all that information, what we're doing is getting a solid foundation on how to better take care of you and then give you tips and to empower you to be a better patient. Nothing is best than to have someone that knows how to really take good care of themselves and empower themselves. And that's our goal. We want to give you the care as a medical provider, but we want you to know how to do it for yourself while you're out there by yourself so that you can come back next year healthy again. So let's talk a little bit about why this is important. Do you know that before a diagnosis is made, for several years you're probably having some of those symptoms that you couldn't identify, but yet your medical provider can just, in just a few minutes, identify them and save your life? I'll give you an example. Sometimes we think that we're tired and we just write it off and think, I'm just getting old. And that may be the case because that's happening to all of us. But in reality, there could be other things, like you can have anemia, a thyroid problem. And so if you come in, we can screen that and make sure that it's nothing more complicated than that. We can't avoid you being sick 100%, but we sure can identify these red flags and just keep you healthy as long as we possibly can. So again, that prevention screening will help you identify these potential problems, and we want to do it. So what is the best time to get a prevention screening? Well, that depends on you. Some people do it at the beginning of the year because it's the new year, a new you, just new goals. Other people do it around their birthdays so that they can remember. But what's important is that you remember. And that's it. That yearly you get in there and get to see your doctor. So at least once a year, like I mentioned. And one other tip is good to know is that most insurances cover this at 100% with no co-payments or deductibles. So check with your insurance because a lot of people don't go to the doctor because of cost. And if you don't have insurance, find places that can provide this care, and there are many in Southwest Florida, including Suncoast Medical, that provide this service to you at a low cost. So do that research and you can find someone. And so now, what do you do if you're thinking about having the screening to be done? So I'll give you a couple of tips on that. So the most important is going to be to make your appointment. Ask your friends, ask your family, who do they see, who do they feel comfortable with? Because remember, you're going to need to feel comfortable with that provider, and at your most vulnerable times, when you're sick, and you know, at other times like now, answering very personal questions. So you may want to do your homework in finding that out. What else? You want to bring a notebook, write down your concerns, tell them to your doctor, start opening up with your doctor to have a good communication, and write down all those recommendations. Make sure that you have those notes so that you can then follow the game plan. And finally, just stick with the plan. That's all you need to do. Just follow that plan for the year so you can come back healthy next year and ready to go without any health problems. So that's it, gang. I hope that helped you in making a decision about making a prevention screening part of your health care. And we want you to stay healthy, Southwest Florida. So keep up the good work. And that has been A Rise to Your Health with Yajaida Vasquez from Suncoast Medical Centers. Have a great day.
Hi, everybody. Thanks for watching Lee Pitts Live. Of course, I'm Lee Pitts, the host of Lee Pitts Live. We're here at the Holiday Inn Airport in Fort Myers, and I want you to continue to watch Lee Pitts Live on television, on YouTube, and of course, listen to us on radio. But to get all of your shows to come right to you, just click on that subscribe button right there, and Lee Pitts Live will come right to you, your time, your way. That's Lee Pitts Live.